Hi everyone, I'm Karen.
And I'm Joe. Together we're part of the amazing team here at marketplaceamerica.org.
Now, health insurance may seem complicated, but it's a crucial safeguard against unexpected medical costs, and we're here to help make it simple.
Yes, indeed. We're here to guide you, educate you, and help you navigate the world of health insurance with ease. We want you to make the best choices for you and your family's health.
Yes, our commitment is to make health insurance understandable, approachable, and tailored to suit your individual needs.
So join us as we dive into the ins and outs of health insurance, and remember, we're always here to help you.
Be sure to like, subscribe, and hit the bell for future updates.
So let's get started.
Hi everyone, I'm Karen, and I'm here with Joe today to discuss the basics of health insurance.
Absolutely, the basics of health insurance. We take for granted that everybody knows what health insurance is, but Karen, I can tell you oftentimes our number one question is, what is health insurance and what's the importance of it? And that's really where we hope to take this topic today.
So we'll start off by talking a little bit about what is health insurance.
Absolutely, we're going to cover that for you, and then why health insurance.
Why is its importance? The different types of health insurance.
That's correct. And then we're going to look at different health insurance terminology briefly with you on that.
Yes. The cost of not having health insurance.
And how to choose a health insurance plan.
And some myth busters.
And then we're going to do some review on some key takeaways from what we've gone over.
Okay.
So Karen, let's go ahead and start out with, what is health insurance? What do you think it is?
So health insurance is really a contract between an insurer, the person insured, and an individual group in which the insurer agrees to pay for specific health benefits.
All right. Well, I got stuck on that word contract. When you hear contract, that's a business relationship, and that's really what it is. It's a business relationship between you and your healthcare and health insurance provider. And you need to understand that health insurance is essential because it helps you protect your health and your finances.
That's for sure.
So Karen, I think we got a fun fact down here. What's our fun fact?
The Blue Cross symbol first appeared in the early 1930s on a health insurance card, making it the first recognized emblem for health insurance.
Absolutely. Blue Cross Blue Shield, and it was the Blue Cross that was the first symbol, and that's kind of a neat fun fact. So now, Karen, let's go ahead and talk about why health insurance.
So why do you need health insurance?
Tell me why.
Well, it's crucial because it's going to protect your financially from high medical costs. It covers services ranging from your routine well checkups to major surgeries.
Absolutely. And medical expenses, they actually get more and more expensive every year. They
Yes,
always
they do.
go up. And if you have a stay in the hospital, that gets exponentially more expensive.
Exactly.
Okay, and for a lot of people, they just can't afford to pay that out of pocket. So you can afford these monthly premiums that you pay for health insurance. So what do we have for an example?
Well, without insurance, a broken leg can cost you about $7,500, and a 3-day hospital stay can cost around $30,000, sometimes more than that. And insurance can help cover those costs.
Health insurance is going to help cover these costs. I don't know many people that can pay out of pocket when they have this happen. Because when you break a leg or you got to go in the hospital, it's immediate. It's not like, well, let me plan for that.
Yeah.
So Karen, give us another fun fact down here.
Well, this is astonishing. Without insurance, a single day in a hospital costs over $2,000 on average.
That sounds pretty cheap to me.
It does.
I think it might be actually more than that, to be honest with you.
That's more an emergency room visit than the actual stay.
Absolutely. So, Karen, now let's take a moment and let's look at the different types of health insurance.
Okay, so it comes in many various forms, like private health insurance, that's your employer-sponsored plans, and marketplace health insurance.
That's right. And then the other one are public health programs like Medicare, and that's for the elderly, age 65 and older.
Okay.
And Medicaid for low-income individuals and families, and really children a lot of times. And then you've also got your military veterans. So you got two primary different categories. So Karen, give us an example.
Well, an employer-sponsored plan might cover you, an employee, and your family, whereas Medicare only covers individuals who are 65 and older or certain disabilities.
Absolutely. So you really need to know some specifics about the different types of health insurance. And look at your demographic, your age, and find out actually where you're going to fall into,
Exactly.
and which one of these type health insurance.
And employer-sponsored health insurance covers about 46% of the U.S. population.
And Karen, I think that's actually lower than I originally realized when I was actually starting to look at this. I felt like the employers would cover 70 to 80%.
Yeah.
And that's absolutely not the case.
It's not affordable anymore for a lot of employers.
No. So Karen, now that we're talking about types of health insurance, let's go ahead and break it down for them in an infographic way that might get a better visual of this. So what do we have here?
Well, in the U.S. health insurance, with our total population is 334 million. And out of that, the insured is about 91% or 306 million people.
All right, so that's the insured. And then we also have the uninsured. And the uninsured actually makes up about 7% or 23 million. And these, we really need to talk to these people. We need them to understand why health insurance is so important.
Exactly.
Okay, but we're going to take this insured population, Karen, and we're going to break it down into what?
You've got your private insurance and your public insurance. So private's about 51.6%.
Okay.
Or 669 million, whereas your public's 48.4%.
All right, that's great. So let's take the private section and let's break that down into different categories. You talked about employer-based. How many is that?
That's about 46% employer-based.
Okay. And then we've got the marketplace or marketplace health insurance. And how many are there?
That's about 4%.
Okay, and we've got that in a different color because we like to focus. That's what we focus on is the marketplace health insurance. Okay. And then if we go over to our public, what do we have over here?
20% on Medicare. That's your 65 and older or disabled.
All right. And then what do we have on our next public section?
About 25% on Medicaid. That's primarily children's and lower income.
Absolutely. And then you've got about 3% military. Okay. So you can see there's 3 different kinds of public, there's 2 different kinds of private. I almost think marketplace can be considered public a little bit too. It's really not, but there's actually financial assistance there to help. But Karen, I know some of our people out there looking going, these numbers don't add up. Okay, why don't they add up?
Well, an estimated 20 million are projected to have multiple sources of coverage. So the sum of the enrolled and uninsured counts exceed the population, and the sum of the percentages exceed 100%. So these are kind of averages.
Absolutely, but this is a good visual overall representation of the entire health insurance marketplace out there.
Now let's look a little bit at our health insurance terminology. There's a lot of terms used in health insurance that a lot of folks aren't familiar with.
Absolutely. I like to think of it as a different language. If you're not used to using these words on a daily basis, you're going to go, what does that mean? So understanding health insurance terms is essential to making informed decisions about your coverage. What do our terms include, Karen?
That's your premium and deductible.
Okay.
Your copay and your max out-of-pocket or MOP. And then your network and coverage.
All right. Well, we're not going to go over each one of these terms in depth with you. We have another video out there. It's called Health Insurance Terms, where we give you examples. We go over it in depth and help you understand how each one of these terms work. We encourage you to watch that video so you'll understand these terms as well when you actually start looking at health insurance. But Karen, we have an example. What's our example say?
Well, your plan may have a $1,000 deductible, and that means you pay the first $1,000 of covered services yourself, and then after that, your insurance company picks up and starts to pay their share.
That's right. So that's just one of those terms. You'll understand how that works after you watch the other video. But here's a head scratcher. The term copay comes from the insurance practice of sharing cost. It means the insurance company is co-paying the bill with you. In other words, once you understand what copay is, you'll have a percentage and your insurance company will have a percentage.
Right.
And based on your contract with the insurance company, they'll pay their percentage and you'll pay your percentage after you actually meet. Now, Karen, here's a pretty interesting topic.
This is the cost of not having health insurance.
Okay. And most people really don't think about this
until
it's too late.
Until it's too late.
Absolutely.
Yes. And not having health insurance can lead to high out-of-pocket costs in the case of illness or injury. So without insurance, you're liable for the full cost of preventative and primary care.
Absolutely. If you don't have health insurance, it's on you.
It's on you.
That's right. And so here's an example. The average cost of a 3-day hospital stay is around $30,000 without insurance. This could lead to significant financial hardship or even bankruptcy.
Right.
And in my mind, the cost of not having health insurance is bankruptcy.
Yes, it very easily can be.
Absolutely.
And medical debt is the number one cause of bankruptcy in the United States.
Absolutely. So that kind of takes us over to our visual over here. It says the number of people who go bankrupt every year because of medical bills. And we got to give a shout out to NerdWallet for providing this infographic. But if you notice, we've got several countries listed up there, and they're all zeros next to them.
Mm-hmm.
It's the U.S. healthcare system that causes this, how we've structured it, how it's set up. But over 600,000 people annually go bankrupt because they don't have health insurance.
Right.
So we strongly encourage you to get health insurance, get covered. There's financial assistance programs out there. You can get covered for as little as $0 per month.
Correct.
And it's definitely worth checking into and getting signed up.
Yep, you just never know.
So I encourage them to sign up for health insurance. How are they going to choose a health plan?
Well, they need to look at their demographics, such as the premium, what services are covered. You want to make sure that your health care providers are in your network and your local hospitals, and the cost you'll incur when you seek care.
Absolutely. So here's an example. If you regularly take a specific medication, you'll want to ensure it's covered by the plan you're actually considering.
Yes.
Okay, if it's not covered, then that plan may not be the plan for you, or you may need to try and find a different plan or a different medicine, get your doctor to change that prescription slightly to where it does count.
And most Americans have a choice in health insurance carriers, but in some rural areas, there is only one insurer.
Absolutely. Those big cities, they got a lot of carriers and there's a lot of people. And in small rural areas, you have less choices when it actually comes to health insurance. So Karen, how are we going to actually use health insurance?
Well, that involves choosing a health care provider, making an appointment, presenting your insurance card at your visit, and then you pay your co-pays or deductibles.
Absolutely. I mean, we take it for granted. We use health insurance all the time. We've been using it for years. But for somebody that's actually new to health insurance, it may be a little foreign to you.
Yes.
Okay, but you've got to select the providers that actually work with your health insurance. You've got to take the card with you. When you go to the visit, they're going to get you signed up. You're going to have to do some basic paperwork.
Yes.
And it's really easy once you do it the first time, but you've just got to do it the first time.
And if you need to see a specialist, you'll need to make sure that they're in your insurance network, or you could be paying higher costs.
Absolutely. And depending on the type of insurance you've got, you may actually need to get a referral to that specialist. So you'll need to check with your plan and see if that's a requirement as well.
And 1 in 10 adults in the U.S. has delayed necessary medical care due to uncertainty about using their health insurance.
Yeah, that's really sad when you think about it.
Yeah.
They don't know how to use it, so they defer and delay and procrastinate. So Karen, let's go ahead and talk a little bit about some myth busters, because when we talk to people about health insurance, a lot of times they're not sure about it if they haven't used it before.
Right.
And so there's many misconceptions about health insurance.
And some people don't believe they need health insurance if they're healthy, or that health insurance is too expensive to afford.
Absolutely. So, for example, in fact, even healthy individuals benefit from insurance by receiving covered preventative care and having protection from unexpected health insurance issues.
Yeah, health issues. And one myth is that only old people need health insurance, but young adults, you have the highest risk of emergency room visits of any age group.
Absolutely. So, and it's if you're breathing, you need health insurance
Exactly.
of some form or time. Just basically, if you're breathing, get insured. So, Karen, let's go ahead and look at some review and key takeaways.
So, understanding health insurance is critical to protecting your health and your financial well-being. So be sure to consider the cost, coverage, and network when you're choosing a plan.
Absolutely. And if you go back to our health insurance terms, we're going to go through all these terms like network and all the terms in depth, and you'll understand them much better. So, but the bottom line, whether you're young or old, healthy or unhealthy, rich or poor, you need health insurance. Like I said, if you're breathing, you need to get insured if you don't have health insurance. If you're not covered, get covered by health insurance today.
At marketplaceamerica.org, it only takes 1 minute to get a quote and about 10 minutes to enroll. Marketplace America is fully integrated with healthcare.gov, and the prices for the plans are the same. But with Marketplace America, we're here to help you when you've got questions or problems. You'll have an agent.
Absolutely. Can't stress that enough. But Karen, instead of talking about marketplaceamerica.org, let's just go show them marketplaceamerica.org.
Great idea.
And so they can see how easy it is to get a quote and get insured.
Good idea. Welcome to marketplaceamerica.org. Health Insurance Simplified.
As your trusted partner for health insurance, we're proud to be fully integrated with healthcare.gov, offering the same plans at the same prices.
What sets us apart is our streamlined process, which gives you access to 1-minute quotes and 10-minute enrollments.
With us, you gain the advantage of personalized assistance from licensed agents at no additional cost. Our primary aim is to provide you with hassle-free experiences, all while respecting your privacy.
And rest assured, we don't ask for any identifiable information until it's time for you to enroll in a plan.
Ready to explore your options? Start by clicking on the See Plans and Prices buttons on marketplaceamerica.org.
You might be surprised to find plans starting from $0 per month.
Welcome to marketplaceamerica.org. On this button and a couple more answers, and we're going to actually have you quotes directly in front of you. And also notice that we don't actually ask for any personal identifiable information prior to getting you that quote. Okay, so Karen, let's use a zip code. Which one do we want to use?
Oh, 303 is good.
All right, I'm going to hit 29303. And how old is the person looking for insurance?
Oh, let's say a 40-year-old male.
All right, 40-year-old male. And did they smoke tobacco?
No.
And are they eligible for coverage through a job, Medicaid, CHIP, or Medicare?
No.
Okay. So as long as we don't check those, tobacco actually increases the price. If we don't check that, it means we're eligible for this. Do they have a spouse?
No.
Okay, they don't have a spouse, and do we have any dependents?
No.
All right, if you had a spouse or a dependent, you click on that and add the age of the spouse or dependent and whether they're male or female. So we're going to click continue right here, and it takes us over to how many people are in your tax household. So think of your tax return. How many people are listed on your tax return? This person's going to say that they're the only one listed on the tax return. And what's their estimated income, Karen?
Oh, let's say about $35,000.
$35,000. And keep in mind, this is purely an estimate. It's not actual. They don't need to go pull it from last year's tax return. It's an estimate. So as long as you have an estimate, you can continue right here. And look at what happens here, Karen.
Oh, it could say $465 a month and could have plans as low as $0.
As $0 per month.
Yes.
That's awesome. So let's go ahead and hit continue. And right now, we're actually not in open enrollment. Open enrollment begins later in the year. This is actually special enrollment. And so to sign up during special enrollment, you need to actually say why you're actually signing up. The most common reason is they've lost coverage, okay, or they've moved. And so we're going to hit say we lost some coverage to get past that screen. And it says, do you have any preferred doctors, pharmacies, or hospitals? Now, in the interest of time, we're going to skip this step, but we can tell you when you actually come over here, you really want to enter your doctors in.
Yes.
Your doctors seem to actually hit the database much better. And then you can actually find the doctor that works for that hospital, and that means that hospital also takes it as well. Okay, so we're going to skip this step. The next one is, do you take any prescription drugs? And you know the prescriptions you take, you can put those in there. You generally want to look for your generic type drugs in here, not your branded drugs.
Exactly.
You find your generic drugs, and then you can actually find those in the list and add those. And it'll actually transfer over here. And wow, Karen, what do we got right here?
Oh, we've got our plans. We've got a 0 premium plan with a deductible of $6,300.
Absolutely. And you've got the ability to actually, and at 0 cost, you max out of pocket. These are all terms that you need to go and take the health insurance terms or watch the health insurance terms video to get more. But you can sort by your different carriers. You can sort by metal levels. You can sort by variety of different things, but it's really that quick to get a quote.
Yes.
Once you find the plan you want, add it to your cart. It's really that easy. The other thing you want to know is that you've got access to dental plans over here as well. So it's really a great resource to come sign up for health insurance.
Right.
You can get your quote in about a minute. You can get signed up in about 10 minutes. And again, there's really no reason for anybody not to have health insurance.
That's true. Well, that's a wrap for today. I hope you found our discussion to be enlightening and valuable.
Yes, thank you for spending time with us today. We strive to make health insurance easier to understand and navigate, and we hope we've done just that for you.
If you have any questions, or if there's a topic that you'd like for us to cover in the future, please leave it in the comments down below. We're here to help.
And don't forget to like this video, subscribe to our channel, and hit that notification bell so you won't miss out on our future videos.
Remember, at Marketplace America, we're not just providing health insurance, we're providing peace of mind.
And if you are breathing and not covered by health insurance, stop procrastinating. Sign up for a health plan today.
Until next time, stay healthy and informed.